but who are with us. The first is my great honor to note that Mr. Jim Pattison is, I believe, listening to us today and on YouTube, and he is so much part of this project. Dick will know this, $75 million contribution for the Jim Pattison Medical Center at the new St. Paul's Hospital. And Mr. Pattison is so much part of a lot of what we've achieved in British Columbia in healthcare in Surrey and in Vancouver and in communities across BC. And I am truly honored to have him with us today and honored by his extraordinary support for this hospital, his patient and dedicated support for this hospital over the years. And I think everyone would agree with that. I wanted to acknowledge the President and CEO of Vancouver Coastal Health, Vivian Iliopoulos, and the whole team at Vancouver Coastal Health who are so much part of this project. And such strong supporters of this project. The whole team there is very much involved in what will be an integrated work in delivering healthcare in our city, and is now, of course, between Providence Healthcare and Vancouver Coastal Health. And finally, I wanted to thank, in particular, especially in this time of pandemic, all of those working in our healthcare system and working at St. Paul's Hospital today. All the healthcare workers, members of the Hospital Employees Union, our ambulance paramedics, at QP Local 873, the nurses, members of the BCNU, our doctors, our health sciences professionals, members of the Health Sciences Association, all of them who make St. Paul's. We can build great hospitals and great buildings, but hospitals, we all know this, are about the people who work there. And the people who work at St. Paul's have made it the great beloved hospital that it is in our province, and we're really honored. I want to also thank everyone at the Archdiocese and everyone at Providence Healthcare for their support of this project. It's an exciting day. We're starting construction on St. Paul's Hospital. Let me repeat that. We are starting construction on the new St. Paul's Hospital, and that makes this a great day and a great announcement. This new hospital will be full service acute care hospital and integrated health campus with a capacity for 548 beds, which includes net new 115 new beds. It will be the home, of course, of many leading provincial programs, as it is now, and referral centers, including heart and lung care, specialty services, and transplants. The hospital will also offer general and specialized care, including HIV/AIDS care, chronic disease management services, emergency and critical care, mental health and addictions beds and programs, ambulatory services, and outpatient services. There will also be Indigenous health services at the center of what St. Paul's does now and what it will do in future, maternity services, and community outreach programs. It will continue to be a teaching hospital, training UBC medical students, BCIT nursing students, and many other health professionals, health sciences, and other professionals. And we expect it to be ready for patients in 2027. People in BC love St. Paul's Hospital, and they're proud of it. It is renowned for its emergency, acute, and critical care, but also maternity, diagnostics, and numerous specialty services. It has developed global leadership in medical care, research, and teaching, and it has deep roots in providing provincial leadership and caring for the most vulnerable people, such as critically ill British Columbians with heart, lung, and kidney conditions, those suffering from mental health, addictions, and other complex urban health issues, such as those living in the downtown east side of Vancouver, the elderly and people with chronic illnesses, those with HIV/AIDS, and many, many more. And this high level of care continues to be delivered currently in a building that was built over 100 years ago, its core, currently in a building that in some ways doesn't meet the needs of people. Currently, though, what shines through is the work of everyone working at St. Paul's. And I wanted to thank and acknowledge Fiona and her entire team for that ongoing work, which is, I think, exceptional. We know how stressful it's been over the past year to be in healthcare. It is, this period of pandemic has been a time when we've all been tested, including those working at St. Paul's Hospital, with challenges around outbreaks, challenges in dealing with the community around it, challenges in dealing with the new reality of a worldwide pandemic. This morning, some of those challenges are clear. We received this morning, just people may be interested on the phone before 10 o'clock, about 1.7 million phone calls this morning showing a high degree of public support and interest in immunization. And I'll be speaking more about that perhaps in the questions and answers. I want to thank all of those behind the scenes. And of course, including the team at PCL Construction, who will be our charge and have won the contract to deliver on this project. It has been a long time coming. This day, this announcement, this hospital project. It was first announced, as you know, in 2002. In the period between 2007 and 2017, we went all the way from having a business plan to being at a pre-business plan stage. And so that took a while. And part of our task, all of our task in the last few years, has not been to make news, but to do the work. And that's what's happened at the foundation. That's what's happened at Providence Healthcare. That's what's happened at Vancouver Coastal Health. That's what I've asked to deliver. Less announcements, more action. And so we've moved from a hospital that was at a pre-business plan stage in 2017 to one where we're starting construction today. This is obviously long overdue, but this hospital, this beloved hospital, with all of its partners and all of its supports out there, I think, make it well worth that effort. It is a significant project, over $2 billion it's going to cost in terms of its budget to deliver the hospital, as you know, and it will create 8,523 direct jobs and 5,383 jobs in its construction. That's over 13,000 jobs for people, which will of course help the economy as it rebounds from COVID-19, but also obviously shows the number of people, all the teams at PCL, all the construction workers, all the planners, all the architects, all the team that will be involved in this project. The new St. Paul's Hospital will be transformative for Vancouver. It will become the home of a world-class public health care, as well as research and a teaching center that will help transform patient care for people in BC. I'm proud that our government took steps to get this project moving forward after so many years of inaction, and we're now on the cusp of getting construction rolling. We are rolling towards the new St. Paul's, and I could not be happier. And with that, there's only one thing that could make me happier, actually, and that is introducing the MLA for Vancouver Mount Pleasant, the Minister of Tourism, Arts and Culture, an extraordinary person and co-worker, an advocate for healthcare in her community, an advocate for her community as a whole, my friend and my colleague, the Honorable Melanie Mark. Over to you, Melanie.
Well, thank you so much. Good morning, everyone. Simgaget, Sigidamanak, Gibwid Wiltsuk. I'm taking part in this amazing announcement from the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh Nations, where my constituency office exists. Thank you, everyone, for taking time out of your day to celebrate this incredible milestone. I know normally for a groundbreaking, we would have shovels and we would be celebrating all of the red seals and everyone that's going to be getting to work on this really important project. It's a tremendous milestone. And as Minister Dix said, all of those years of advocacy, the tireless advocacy, everyone paddling together to make this possible in order to have this transformative, state-of-the-art facility coming to our community, my constituency of Vancouver Mount Pleasant. I want to acknowledge the work of and the importance of reconciliation and what this building is going to mean for generations to come. When Minister Dix talks about loving the existing St. Paul's, we're going to love the next generation of St. Paul's for the next 100 years. And just again, acknowledging what Minister Dix emphasized, it's about people. It's about people. It's about what they do every day. People that are relentless in their passion for healthcare, thanking the workers for what they do each and every day, and thanking all of the partners who brought their money to the table. That's important, that we paddle together, that we chip in together, and that we make these important investments so that we all win. So thank you so much for taking part today. I'd like to introduce my colleague, newly elected MLA, Brenda Bailey, who is the member for Vancouver Falls Creek.
Thank you, MLA Mark. I'd like to acknowledge with respect the history, the customs and culture of the Musqueam, the Squamish, and the Tsleil-Waututh peoples on whose land I live and work. And it's great to be here for this big day. There's so much excitement. I'm so proud that our government has followed through on its commitment to the people of Vancouver and all of BC by taking action to build the new St. Paul's Hospital, which we're breaking ground on today. As you've heard, it's a project that was long overdue, but our government recognized the need to move forward with planning a new facility. And this new hospital will serve more people and offer even better access to the public healthcare people have come to expect. I want to thank Minister Dix and Premier Horgan for their dedication for a new hospital and investing in services that bring people closer together. And the new St. Paul's Hospital will do just that, serving as a hospital, but also as a community hub. I'm especially pleased with the patient-centered design integrated throughout this incredible healthcare campus. Moreover, the commitment to integrating new and impactful technologies into healthcare to benefit patients and to support the work of researchers and students will ensure this facility will provide leading-edge care to the residents of Vancouver and to the province. Thank you. At this time, I turn it over to Fiona Dalton, who's the President and Chief Executive Officer of Providence Healthcare.
Thank you so much, and I'm proud and humbled to be here as part of this special day on the traditional and unceded homelands of the Musqueam, the Squamish and the Tsleil-Waututh. And more specifically, I'm here in the old St. Paul's on the land that has always been called Aylsham and is now called the West End. So on behalf of everyone at St. Paul's Hospital and everyone within our Providence Healthcare family, including patients, families, staff, physicians, researchers and volunteers, thank you so much, Minister Dix, for delivering on your commitment to make the new St. Paul's Hospital a reality. Our bold vision for the new St. Paul's is to lead the world in the delivery of healthcare, providing patients with the highest quality, integrated, compassionate and patient-centred care where and when they need it most. And our aim is to do the very best for patients and their families. The world is changing and the people we serve expect us to learn, adapt and lead the way to meet their healthcare needs. And the new St. Paul's will help us achieve this. But as previous speakers have said, it's about so much more than just a new modern health campus and buildings. This development will embody new models of value-based healthcare and define, in partnership with patients and their family, the way that you want to be treated. This is our legacy from the founding sisters of Providence, who built St. Paul's Hospital almost 127 years ago. And I imagine if they were here in a magical time machine, I think they'd also be here saying thank you. Thank you for taking our legacy and renewing it for another 125 years. So we will build on St. Paul's current provincial leadership role and proven reputation in many areas, hearts, lungs, kidneys, HIV/AIDS, so many more. And we'll strengthen the regional and provincial care networks with all of our healthcare partners, particularly the Indigenous communities and partners that we serve. So we're aiming really high by striving to be the best in patient-centred care, research, education and innovation across all of our services. We do aim to change the world for the patients that we serve and for the people of British Columbia. So thank you so much for this special day. And it's now a real pleasure to introduce my good colleague, Dick Bellette, Chief Exec of the St. Paul's Foundation.
Thanks, Fiona. I too am very honored and privileged to be here on the traditional territories of the Musqueam, Squamish and Tsleil-Waututh nations, and honored for their stewardship and allowing us to be here today to break ground with the new St. Paul's. I know, Minister Dix, you mentioned that this has been dreamt about for decades, and you're correct. It has been dreamt about for decades. And I think for me, the real time when it started to really become real was when two city builders got together and really put their shoulder behind St. Paul's. And I'm talking about Bob Lee and Hugh McGee, who really took an interest in St. Paul's and brought it to the board and really started to push the envelope. And then, of course, 4 years ago, Jimmy Pattison made the historic $75 million donation to the new St. Paul's and the Jim Pattison Medical Center. And I would say that Jim Pattison, Hugh McGee and Bob Lee truly galvanized the philanthropic community behind this project. And the rest is, as you say, history. And I don't think we'd really be here without that kind of leadership and city builder. I'm also humbled to see the frontline care workers in healthcare deliver what they've done for the last year and a half through this pandemic. And what it's done is it's really shown us that access to really good, reliable healthcare is really important for everyone in British Columbia. And I'm also impressed by the number of people who have given over $1 million to this project. And as you said, we've, all about action, getting things done. And so what I really want to do is take a moment to recognize those founding donors who have also given more than $5 million to this project. again, inspired by Jimmy Pattison, Bob Lee, and Hugh McGee. Very short list, but I just wanted to recognize them. The Gemini Foundation, the Tech Resources Limited, the Cullen family, the Lalji family, the Tong and Geraldine Louis Family Foundation, the Rotary Club of Vancouver Hearing Foundation, and finally, Mr. and Mrs. P.A. Woodward Foundation. Some names I'm sure many of you recognize who have really helped make BC such a great province to live in. So we are so grateful to everyone who has donated to this project. We're humbled to be here to be part of this transformational project in British Columbia healthcare. So thank you. Thank you, everyone.
Thank you, everyone. It is now time for questions. Reminder, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please also take your phones off mute. You are not audible until your name is called. First question today is from Katie DeRosa, Vancouver Sun.
Hi, Minister. Unfortunately, this is unrelated to the hospital announcement. I'm sure you're aware about the high call volume received at the Ministry of Health, the authority call line for the vaccine. I'm just wondering, is this a result of lack of staff? Is this a result of people who are not eligible calling in? Like, what is causing this backlog?
Well, thanks for the question, Katie. As of about 9:40 a.m. this morning, we had registered about 1.7 million calls. I just want to put that in context. There are about 47,000 people 90 and above in BC, and they're the eligible group. And there's another 35,000 Indigenous people over the age of 65. So those are the 2 eligible groups. I'd also point out that a significant number of people within those groups have already received an immunization. We've immunized over 80, approximately 45,000 people already, whether it's in long-term care or assisted living or other places. So I very much appreciate the enthusiasm of everybody calling in, but I would ask that people allow those who are eligible this week to book appointments, to have priority. We need, if you're not calling on behalf of someone over 90, we'd like 1 person per person over 90 to call in, or you're not over 90 and above, or if you're not an Indigenous person, 65 and above. This is not the time to call in. This is the time to call in and book appointments. We're booking thousands of appointments. We'll have details on the numbers of appointments booked at 3 o'clock. But obviously, that is a massive number of phone calls. And if that were to continue, obviously, no phone system would respond to that. So we need a combination of both. Our partners at TELUS, I think, are working very hard and in the health authorities to respond, and appointments are being booked. I want to say to people that there are lots of appointments, that we have 5 days to book appointments for those over 90 and Indigenous people over 65 here. So if your appointment isn't booked today, there will be space and there's appointment time to be booked. And so the opportunity is there. It's an enormous response. It reflects, I think, the very significant support for immunization in the province, which obviously is heartening. But we really need this to be a time when people over 90 are allowed to book their appointments, and that people and Indigenous people over 65, which means that if you're not in those categories, please don't call us today so that we can continue to proceed through those appointments. We've got 5 days to do it. There's going to be lots of time. If you haven't been able to get in touch with us today, there's lots of appointments, and we're going to be able to take care of you in the next few days. So in short, it's an enormous response. But there are only 47,000 people 90 and above in BC, and those are the ones we want to hear from. Only 35,000 Indigenous people over 65. Those are the people we need to hear from this week. They're the ones who can book appointments, and we'd ask everyone else to both be patient and to wait for the time when they're able to book appointments as well.
Katie, do you have a follow-up?
Yes, please. Are you finding that individuals who are outside the 90 and above or 65 and above for Indigenous people, are they trying to call and make a case? Are they pleading their case for why they should get it early? Or are multiple people from one family member calling in on behalf of one elder, a person over 90?
I think it'll be a combination. As you know, as I noted, 47,000 people over 90 eligible in the general population, another 35,000 people eligible in the First Nations population. Some are in both categories there. So we're talking about roughly 80,000 people eligible right now to book appointments this morning. And, you know, in the first 2.5 hours, we received 1.7 million calls. So obviously we're getting some calls beyond that group of people. Obviously some people are calling multiple times as well. And we're booking lots of appointments. And what I'd like to say to everyone is we're going to get people booked. There's lots of appointments. They're not running out. We're going to be able to make sure that everyone over 90 starts to get immunized next week, and we're going to do it. We've got 150 plus locations that health authorities announced yesterday, but we really need people who are not over 90, not calling on behalf of someone over 90, or Indigenous people who are not 65 and over, or calling for someone 65 and over not to call in today, so that we can allow those who are eligible to book appointments today to book appointments. And that's what we really need today. It's we expected this to be a big start, and it has been, and we appreciate the enthusiasm, but if you're not eligible to call in today, please don't call in.
Next question is from Martin McMahon, News 1130.
Hi, Martin.
Hey, Minister Dix. Hi, Minister Dix. Yes, in terms of what you're seeing here with the phone lines, will you be considering changing the approach for further phases of vaccine booking?
Well, we are, of course, Martin. As you know, when we go to a broader population group, starting on April 12th, there'll be a very significant online program platform to contribute to that. There is an online platform right now as well in Fraser Health, which is taking significant numbers of appointments as we speak today. So that's the intention. The intention was to start with this group of people, focusing on the phone side of it, and ensuring that we provided good service. That this was not the population group where we were going to start with our online platforms. That we're going to prepare our online platforms, and we expect them to take over the lion's share of the appointment booking after April 12th. So that's precisely what we presented last Monday, and I think that will be helpful. But for the moment, remember, this is not first come, first serve, that there's going to be appointments available all week, that we're booking for 5 days for people 90 and above, people born in 1931 or earlier. And so there's going to be lots of opportunities. There's lots of appointments. And I think this just reflects the absolute interest in people getting immunized in our province. And I think that's a great thing. I had the opportunity to talk to some people doing the immunizations this weekend, Martin, who are going to people's homes right now, particularly recipients of long-term home support. And many of those people, we've had a lot of discussion, and it's very important about people who have been isolated in long-term care, but as well many people who are in senior categories and receiving long-term home support have really been isolated in their homes for a long period of time in the past year. And I can tell you the stories that we're hearing from people about their experience of being immunized and what it means to them are very moving. And I think we're going to be obviously hearing more of that. So what's happening this week? We're finishing off, we're doing all first dose immunizations in independent living. We're working with long-term home support. We're dealing with outbreaks as they occur. We're supporting our essential healthcare workers, both in the community and in acute care, in getting immunized. So there's a very significant amount of immunization taking place this week. And this booking, which is happening, is for next week, and everyone will get a chance to get immunized in the eligible category. And I just ask everyone else to give them a chance to book their appointments.
Martin, do you have a follow-up?
Yes, we've heard of ineligible people showing up and in some cases being turned away at some vaccine clinics, say for people living in supportive housing in the downtown east side. Is that something you're aware of? And if it is happening, can you give us a sense of the scale of that?
I think some of that is happening. As you can see from this morning, there is enormous interest in people being immunized against COVID-19. And in Canada, The federal government, as you know, is responsible for getting vaccine, and we have more vaccine now, relatively speaking, than we've had, but we have to deliver the immunization campaign, given the amount of vaccine we've received from the federal government, in a way that protects those who are most vulnerable. Lots of people, of course, want to get access to the COVID-19 vaccine, but we're doing it in order of vulnerability here, and to do it any other way would be to leave our most vulnerable more vulnerable, and we don't want to do that. So we're starting over 90 next week. Starting next Monday, we'll be booking appointments for people between 85 and 89. The following week, between 80 and 84, we'll be booking the appointments, and then doing the appointments in the general population after that. And I know that there's always a sense people want to be immunized, so they want to get it to advance somehow in the queue, but we're going to try, and we're going to continue to try and keep people safe, both our healthcare workers, people in long-term home support this week, as we've already done in long-term care and assisted living, and we're just going to continue to use the vaccine that we have. And I think the most efficient way to protect the most vulnerable people first, and I think there's enormous support for that, and we're just going to continue to work away. And I understand that some people may see their own circumstances and wish to advance, but this is, I think we've sort of presented the reasons why we're starting with an age-based approach, and have started by protecting long-term care and assisted living, and I think overwhelmingly people understand that.
Richard Zisman, Global News.
Hi, Richard.
Hi, Minister. Congratulations on the announcement today. I've heard from a number of people, both in Fraser Health and Coastal Health, and the experiences this morning seem to be different. Those that were able to book online in Fraser Health had some technical problems, but mainly were able to make an appointment. Those in Coastal expressed frustration that in some cases they were on the phone for 3 hours and then got booted out of the system. Should there have been an online option in all the health authorities to ensure that this went a little bit more smoothly this morning for the 90 plus, 65 plus group?
Well, Richard, there will be, and we'll be presenting our online platform, and that will be in place when we go into a broader general population once vaccine arrives in those sufficient quantities in the weeks to come. So the short answer is we do believe in that an online platform will help, and this is day one of booking of immunizations, and as you can tell from our call volume. With 47,000 people, 90 and above in BC, and 1.7 million calls, there is a lot of enthusiasm out there. And really, our core message is that we need people to make way and to allow people 90 and above, Indigenous people 65 and above, to receive their immunizations. And so we're asking people who are not in those categories not to be calling us today, and we're going to just sort of work our way through it over the next 5 days. There's if it's difficult today, there'll be opportunities tomorrow and Wednesday and Thursday and Friday, and there's lots of spaces, lots of appointment spaces that will be available, and we're going to get everyone in there who's 90 and above. So the short answer is there will be online platforms across the system as we broaden out our immunization, and we expect they will in future take the bulk of the immunizations. This week we've given 5 days for this group of people to get immunized, and we're hopeful that will happen. And I think the response today really reflects the interest and the support for immunization, which is, as you know, an important part of what we're trying to achieve.
Follow up, Richard?
Yeah, I'm aware, I know that the online booking system is coming, the 79 and lower, but Fraser Health put it out today for the 90 plus group, and will be available, as you know, for the group in the 80. So should the other health authorities have had the online system already ready? And you mentioned that this is an example of how people want their immunization. Like, clearly they're desperate for it. And what do you say to those who are feeling this great sense of desperation not being able to get through?
There are appointments waiting for them in the 90 plus category. And it's why we have 5 days here for people to book their appointments. And there will be opportunities through the week to do that. You're not losing out if it doesn't happen today. And to everyone else, I'd say, yeah, absolutely. I understand that, believe me, I understand maybe better than most because of all of the people I speak to all the time about the desire of people across BC to be immunized and to get their vaccine, to get their first dose of vaccine. It's the reason we've made the effort we've made. We're focused on protecting those most vulnerable first, and you've seen the positive impact of that in long-term care. So I hear you, is what I'd say to everybody, that we only have the vaccine that we have, that in Canada, in our system, that is procured by the federal government. They're working hard to get us as much vaccine as they can, as soon as they can, that we're not going to get involved in some complaint process in Canada when it's our job to, here in BC, to deliver the vaccine that we have, and we're going to. Of course, we'd like to have more, but we're getting more, some more now, and we're ensuring that populations who need to be immunized are immunized. And I think all of that is very positive. But yes, I understand people want to book appointments. We can tell that from the enormous response. We knew that beforehand, and they're going to have that opportunity this week, and then between 85 and 89 next week, and between 88 and 84 the following week. And what we're asking everyone else to do is to give them the opportunity to do that. And I believe as this week goes on, that will more and more be the case.
Next question is from Shannon Patterson, CTV.
Hi, Shannon.
Oh, hi, Minister. Hi. So you may have seen that the Center for Disease Control in the United States have just released new guidelines for fully vaccinated people. So my question is, when can British Columbians expect some guidelines of what fully vaccinated people can do? Some of these seniors are going to really want to see their grandchildren or even visit amongst one another again. In the U.S., they're saying people who've been fully vaccinated can visit each other mask-free. They can also visit small groups of unvaccinated people in some circumstances. So when can BC expect our own guidelines for what the fully vaccinated can do?
Well, thanks, Shannon. On Friday, there were more than 600 test positive cases of COVID-19 in BC. We'll be announcing at 3 o'clock the number of cases over the past 3 days, and you could expect those numbers to be significant as well. So we have a COVID-19 pandemic. We know that the vaccine protects people. You saw that in the evidence presented by Dr. Henry and Dr. Ballum last Monday. So we know how effective these vaccines are. All of the vaccines, all 4 of the vaccines that have been now approved in Canada, 2 of which we have in BC right now, 1 of which is coming soon, and 1 we hope to have in the near future, the Johnson & Johnson. These are effective vaccines. But there's some things we don't know, including one's ability to transmit COVID-19 even when immunized. So for the moment, we're going to continue to have everybody follow the public health guidance and the public health rules with respect to social physical distancing and so on. So that's what we need to continue to do for some time. We expect, I think I told you about a month ago, based on what the federal government was telling us, that we would have immunized roughly 10% of the people who are eligible to be vaccinated in BC by the end of March. That number will be higher now. It will be closer to 15%, we believe. But that's nothing like community immunity. And what we need people to do is to continue right now to follow the rules and to continue to follow the guidance of public health. It is especially important with these levels of transmission being what they are. So while what the vaccine shows is what can happen in the future, and the discussion of such guidelines shows what can happen in the future, we can't live the future in the present. We got to live the present in the present. And the present is that we continue to take all the steps we need to do to control the transmission of COVID-19. And that includes those who have been immunized and not immunized. What will happen in the next month, though, in the month of March, is some changes. Some have already happened within long-term care homes in terms of activity, but in terms of long-term care, to allow people, especially in that in those care homes where we've reached that community immunity. More than 90% of healthcare workers, more than 90% of residents, a very significant, I think 6,000 essential visitors. In that area, there will be the opportunity to expand out opportunities. And we're going to continue to do that work, for example, in home support and other areas so that we can allow people to do more sooner. I think things are going to get better in the later spring. We're not quite at spring yet, even though today feels like spring. And then better again in the summer as we see seasonal reductions in transmission and obviously the impact of immunization. But we're not there yet. People have to keep following the rules and following the guidance.
Shannon, do you have a follow-up?
Sort of along the same line, is it really fair to expect, especially seniors who haven't been able to be social, some seniors who lived on their own, who haven't seen their kids and grandkids, don't you think there'd be a better uptick in vaccination if people knew that there was a light at the end of the tunnel and they knew exactly what they can do if they were vaccinated? Now Americans know. Why can't we know what we can do when we're vaccinated? All we're being told is to hold the line, but don't you feel like British Columbians deserve to know what the benefits will be once they are vaccinated and how quickly they can get those benefits?
I think British Columbians know we're in a global pandemic and the impact that that's had, the lives lost, the impact on people's lives, the impact on healthcare, the impact on our society, the impact on people well beyond the pandemic. So there is a lot of hope in our future in terms of being able to move out of restrictions. My point, Shannon, is that we're not there yet, and that we had more than 600 cases on Friday, and that we need to continue to take steps. In other words, our near future is looking much brighter, and that people will be able to return to many of our normal activities in society, but that we're not at that moment yet. I mean, you talked about the BC CDC announcing today something, and obviously in the United States, there is considerably more vaccine than procured by the government of the United States than there is procured by the government of Canada. And so we have to deal with the situation we're in. But I'd say finally, there's a lot of enthusiasm for vaccines. We see that this morning. We've got, right now, we've got a little bit more enthusiasm than vaccine, but a lot of people are getting immunized. And so I'm very positive about the public response here. I'm very positive about how the vaccine are changing lives, including those in long-term care where we've had a lot of vaccination. And I think the future is bright, but we can't live the future right now. We've got to live the now right now. And the now is that we have to continue to follow public health orders, knowing that things are going to get better in the near future.
We have time for one more question today, and that comes from Naomi Mukanda, CBC Radio Canada.
Bonjour, thank you very much. Ministre Dix, premièrement, est-ce que vous pouvez faire le point en français de la situation justement de prise de rendez-vous aujourd'hui? Combien de personnes? Qu'est-ce qui explique ce grand volume d'appels? Et puis à quoi s'attendre pour les prochains jours?
Oui, effectivement, je pense qu'il y a beaucoup d'enthousiasme pour la vaccination, bien entendu, surtout après un an de pandémie. Donc, bien entendu, on a reçu ce matin à environ 9h30 1,7 million d'appels, ce qui est une réponse extraordinaire, mais c'est trop quand même. Il y a à peu près 47 000 personnes en Colombie-Britannique qui ont plus de 90 ans et un autre 35 000 personnes autochtones qui ont plus de 65 ans. Donc, ça, c'est le nombre de personnes qui sont en mesure, qui sont éligibles de recevoir leur date de vaccination cette semaine. Donc, j'ai fait appel à tout le monde. Si on n'est pas, c'est pas votre tour actuellement de ne pas nous téléphoner pour que les gens qui ont plus de 90 ans puissent être en mesure de recevoir leur date, leur moment, n'est-ce pas? Et je pense que, mais en général, ceci démontre l'enthousiasme des gens pour la vaccination, ce qui est bon, mais il faut être mesuré d'attendre notre tour. Et c'est maintenant le tour, c'est les gens de 90 ans, c'est autour de ces gens-là l'opportunité d'avoir une date de vaccination cette semaine. Donc, si ce n'est pas vous, ne pas nous téléphoner aujourd'hui.
Follow-up, Naomi?
Yes, please, thank you. And I wanted to know as well in French and in English, how many places giving vaccines today?
Sorry, I didn't quite hear that. The line was garbled.
How many places are giving vaccines today, both in French and in English, please? Thank you.
Effectivement, il y a aujourd'hui et des autres jours de cette semaine, on fait un peu de la porte-à-porte pour des gens qui reçoivent des soutiens chez eux. Donc, il y a des milliers d'endroits où on fait des vaccinations actuellement. Hier, les régies de santé en ont annoncé 150 endroits pour phase 2 de notre campagne de vaccination. Mais cette semaine, on a toutes les vaccinations dans l'independent living, toutes les vaccinations pour les gens chez eux, surtout les personnes de troisième âge chez eux et d'autres, des gens qui travaillent dans les centres de santé, un peu partout dans la province, mais y compris dans la communauté. Donc, il y a beaucoup de monde, n'est-ce pas? On a déjà vacciner des gens qui habitent les maisons de soins au long terme, c'est-à-dire des centaines des gens qui habitent assisted living. Donc, on a beaucoup de monde, beaucoup d'endroits, beaucoup de lieux de vaccination actuellement. Et surtout dans les communautés qui sont plus petites, un peu partout dans la province, on a aussi des centres là-bas. Donc, jusqu'à maintenant, il y a des milliers de lieux de vaccination et ça va continuer. Et pour la phase 2, on a annoncé hier 150 pour la deuxième phase de notre campagne de vaccination. Donc, c'est un effort quand même extraordinaire et un effort qui va continuer jusqu'au bout.
Thank you. That's all the time we have. I will quickly ask for all of the participants to briefly pause for a photo.
And Lindsay, can I just do one other shout out to my friend, Bishop of Vancouver, Most Reverend J. Michael Miller, and all his team at the Archdiocese who are so much part of this project. Their activities mean so much. Their legacy at Providence Healthcare is extraordinary. And I just want to say, because we work together on so many things all the time, how appreciative I am of His Excellency's work. And I wanted to give a shout out to him, and I hope he's on the call. I hope he managed to survive all those questions on immunization.
Thank you. Okay, everybody, please pause and say cheese.